Our minds are incredible. They hold our thoughts, our memories, and our sense of self. But sometimes, the mind can work in ways we don't fully understand. It can be confusing and even scary. Imagine feeling like you have different parts of yourself that don't always get along. Imagine not remembering what you did yesterday or feeling like you're watching yourself from outside your body. This is the reality for people living with dissociative identity disorder, or DID. It's a complex condition, but we can all learn more about it. Understanding DID starts with compassion and a willingness to learn. Let's explore this together. Dissociative identity disorder, or DID, was once called multiple personality disorder. It is a mental health condition. People with DID experience a disconnect. Their thoughts, feelings, and actions can feel separate from each other. Imagine your mind is like a puzzle. With DID, the puzzle pieces are there, but they don't always fit together smoothly. Different parts or alters might hold different memories, have unique personalities, and even act independently. DID is often caused by severe trauma, especially during childhood. It's as if the mind creates separate parts to cope with overwhelming experiences. It's important to remember that DID is a real disorder and not something people choose or pretend to have. It can be hard to tell if someone has DID or dissociative identity disorder. The signs can be subtle or mistaken for other conditions, making it challenging to identify. However, there are some things to look out for that can help in recognizing DID. People with DID might experience memory gaps, often losing track of time. They may have trouble remembering everyday events or important personal information, which can be very disorienting. They might feel like they are watching themselves from a distance, a phenomenon known as depersonalization. Sometimes, people with DID hear voices in their head, which can be quite distressing. These voices can belong to different parts or alters, each with their own distinct characteristics. They might also have sudden shifts in mood, behavior, or even their sense of identity, which can be confusing for both them and those around them. If you are concerned about yourself or someone you know, it's important to seek help from a mental health professional. Early intervention can make a significant difference. Let's imagine a young woman named Sarah. She appears to be just like any other young woman, but her life is far more complex than it seems. Sarah is a talented artist, but she often feels lost and confused. Despite her creative abilities, she struggles to maintain a sense of normalcy in her daily life. She has large gaps in her memory and sometimes finds herself in unfamiliar places, unsure how she got there. These moments of disorientation are both frightening and disheartening for her. Sarah hears voices in her head, each with its own distinct personality. These voices are not just figments of her imagination, they are parts of her identity. There's Emily, a scared child who embodies Sarah's deepest fears and vulnerabilities, and Ethan, a protective but angry young man who often takes over when Sarah feels threatened or unsafe. These parts represent different aspects of Sarah's experience and trauma. They are her mind's way of coping with the overwhelming emotions she has endured. Sarah's story is just one example. There are many others like her, each with their own unique journey. Every person with DID has their own unique experience and set of alters. These alters serve specific roles and functions within their lives. It's crucial to remember that DID is a way of coping with extreme trauma. It is a survival mechanism that helps individuals manage their pain. It's not about attention-seeking or being dramatic. It's a real and serious condition that requires understanding and compassion from those around them. Diagnosis. Finding answers in the DSM-5TR. Diagnosing dissociative identity disorder, or DD, is a complex and intricate process. It requires the expertise of a trained mental health professional who understands the nuances of the disorder. These professionals rely on a comprehensive guide called the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5TR. The DSM-5TR outlines specific criteria that must be met for a diagnosis of DID. The mental health professional will look for evidence of distinct identities, memory gaps, and other key symptoms. They will also carefully rule out other possible conditions that might explain the symptoms. The diagnosis process can be lengthy and requires thorough evaluation. It's important to be patient and work closely with a therapist who has a deep understanding of DID. Remember, receiving a diagnosis can be a significant relief. It provides a name for what you're experiencing and opens the door to appropriate treatment and support, helping you move forward. Paths to healing, treatment for DID. There is no quick fix for dissociative identity disorder. Treatment usually involves long-term therapy with a specialist. The primary goal is to help the person manage their symptoms, improve their daily functioning, and work towards integrating their different parts. Therapy for DID often includes talk therapy, such as psychotherapy. This helps the individual understand their trauma and develop healthier coping mechanisms. Medications might be used to address co-occurring conditions, such as depression or anxiety. It's important to remember that healing takes time. The journey might be challenging, but recovery is possible with the right support and treatment. Offering support and understanding. If you know someone with dissociative identity disorder, the most important thing you can offer is support and understanding. Educate yourself about the condition so you can be empathetic and non-judgmental. Avoid saying things like, "That's so cool," or "Can you make your alters come out?" These comments trivialize their experience and can be hurtful. Instead, listen with an open mind and heart. Let them know you're there for them, no matter what. Remember, people with DID are not defined by their disorder. They are individuals with strengths, talents, and a desire to live fulfilling lives. A call for understanding. Dissociative identity disorder is a complex and often misunderstood condition. It's time to move beyond the myths and stereotypes and embrace compassion and understanding. By learning more about DID, we can help reduce the stigma surrounding mental illness and create a more supportive world for those who need it most. Let's continue the conversation with open minds and open hearts.